So let's talk about what we do to try to determine if someone is having acid reflux. Now, typically for this, we are going to do an upper scope. If a patient has had reflux for any length of time over about 6 months, we want to get in there and look for any structural causes like ulcers, inflammation, or hiatal hernia. But then a lot of times, only 20% of patients who have acid reflux or GERD will show signs of it on a scope. So you have 80% of people who are getting the scope done and they get no answers as to what is going on. That's where an acid pH test comes in, and this is something that I order pretty frequently for my patients. So there's typically two options for an acid pH test. So the first option is after we do that upper scope, the physician can actually go back down and place a tiny capsule using medical grade suction. This capsule has a pH sensor in it. And so we place it using suction, and then the patient will go home with a little box recorder that is going to monitor for any data that would indicate that they're having reflux coming up into the esophagus. So when this capsule is in place, what we are doing is we are monitoring for any abnormal acid exposure to the bottom of the esophagus. Acid should not be coming up into the esophagus frequently. All of us can have occasional times where reflux will come up into the esophagus, but for the majority of time, that should not be occurring. We monitor for this acid change for a total of 48 hours, and then this little recorder that we also send has buttons to push where we try to correlate the symptoms that a patient is having. So if they're having chest pain, heartburn, regurgitation, cough, all of those things, we would have the patient press a button and we try to see if it correlates to any events of reflux. So when we're doing this test, we are trying to figure out how often and how much acid is coming up into the esophagus. It's a very good test that would be a good indicator that someone is having GERD and can direct treatment.